Hi everyone, welcome back to my channel. If you are new here, my name is Ababio. I am a nurse here in Ghana. Today's video is for anyone who is actually preparing for the NMC written examination. Whether you're a student nurse, midwife, or just someone who wants to understand what to expect. I know how stressful and overwhelming these exams can be, but don't worry. In this video, I'm going to break down a full study plan, what topics to cover, and how to practice, and even what to expect on the actual exam day. So, grab your pen, your notebook, and let's get started. Now, with the part 1 of this video, I want you to first of all understand the exam. You need to understand the exam. Now, first, let's talk about what the NMC written examination is really about. The NMC, or the Nurses and Midwifery Council of Ghana, conducts written examination for various categories like the registered general nurses, midwives, mental health nurses, public health nurses, and more. You can't become a licensed professional without passing this exam. This exam is usually a multiple choice question with a few structured or short answer questions depending on the level. It is not just about memorizing the fact. They sometimes want to test your clinical judgment, your critical thinking, and how well you apply these knowledges. These are some of the topics you should be expecting: anatomy and physiology, medical surgical nursing, midwifery questions, pediatrics, mental health, community health, and even professional ethics and law. Now, with this part 2, I want to talk about how well you are going to study so that you prepare very well for this examination. Now, let's talk about your preparation plan. I recommend you give yourself around 12 weeks to study, but feel free to adjust depending on how much time you have. During your first week of preparing for the NMC examination, first of all, start by building a foundation. Now, how do you build this foundation? You have to start by getting the official NMC syllabus, right? You can find it from your school, or even you can check online for them. Gather your study materials. When I talk about study materials, I'm talking about your textbooks from level 100 to 400, your notes, and don't forget your past question. I would recommend using the one-touch past questions as it really helped me a lot during my time. Focus on anatomy and physiology very well. See, most of these questions that you'll be meeting, especially medical and surgical, will be under anatomy and physiology. If you don't understand the human body, the rest will be very difficult. So take note of this, create a schedule and aim to at least study for around 2 to 4 hours a day just on anatomy and physiology. Now, during your 3rd to 4th week, make sure you go with medical surgical nursing. Now, this is one of the most important sections when it comes to the exams. Study different diseases, make sure you get their signs and symptoms, their diagnosis, their treatment, and also their nursing care plans. If you really want help in doing that, you can leave it in the comment section. Contact me, send me a DM, and I'll get back to you on how to actually do this. During the week 5 to 6, make sure you study midwifery and pediatrics. Study pregnancy stages, their labor, delivery, postnatal care, and don't forget to study danger signs in pregnancy and also the normal labor procedures. These points are very important. For pediatrics, make sure that you review developmental milestones, very important, child nutrition, common childhood illnesses, and also immunization schedules. During week 7 to 8, make sure you go with the mental health and community health. Notice your basic mental health conditions like depression, schizophrenia, bipolar disorder, and other mental health conditions that you know about will actually present or be in the examination you'll be writing. Alright, so know these basics under mental health. For community health, make sure you focus on disease prevention, focus on CHIPS compounds, and how community nurses operate within Ghana's healthcare system. During week 9 to week 10, make sure that you study the NMC Ghana Code of Ethics, patient rights, legal responsibilities, and documentation. They can ask about scenarios involving confidentiality or professional misconduct in their examination. And during the 11th week, practice, and practice. I go again. I say during the 11th week, that is where you do practice questions. Okay, you practice solve past questions. Like I said, do not joke with the past questions. Go through past NMC examination questions, either from your school or even online sources. Like I said, I use the One Touch. You can also try it. It is very good. It comes with questions and also gives you the rationale for the answers to those questions. For that matter, it broadens your knowledge about the topic and what to be expected from the examination. Remember, as you solve these past questions, make sure you time yourself. Okay, create an exam condition. Okay, time yourself, grade yourself. This will help with time management and confidence. During week 12, do your final revision. Remember, go over difficult topics. Topics that you really find a problem with. Remember that these exams have been divided into 3 parts. For the written, it has been divided into 3 parts. You will be doing the medical, the surgical, and you'll be doing the general paper. Okay, so make sure that you revise very well. Okay, go over difficult topics and make sure that you get them well. Remember, don't overstudy. Alright, during the last week, don't overstudy and make sure you get a good enough rest. Okay, now let's talk about the part 3 of this video. Now, the part 3, I'm going to give you study tips for your success. Okay, I'm going to give you some study tips for your success during your preparation. Okay, so here are some tips that really worked for me and others I've spoken to. Now, these are the first one: smart study tips. Now, remember to use words or to use keywords to identify difficult medical or surgical terms that you find difficult to remember. Okay, for example, remember the cranial nerves using an old Olympic Taryn tops. Okay, teach what you've learned to others. Okay, it's another study, a smart study step. Okay, teach what you've learned to others. Teaching helps you to remember better. Teaching really helps you to remember better. Record your notes as voice memos and listen to them while you are walking or commuting. This really helps. Like me, what I did was I took the past questions, I answered the past questions, recording them. Then after that, as I'm even walking around, sleeping, or doing anything, I just put my earphones in my ears and I start playing over those past questions that I have read. This really helped me to really capture and understand or get the concept. Okay, it helped me to memorize those points that I really find difficult to. Also, another tip I will give you is to do the exam simulation. Like I said, do at least 1 full-length mock exam per week. Okay, don't forget to do it as like how you are doing the examination. Try a different format. Use multiple choice questions, scenario based, and even short answer questions. And remember, don't just memorize the answers. Understand why an answer is right or wrong. Like I said, I used the one touch and it gives me a really good understanding because it was adding rationales to the answers. Remember to make sure that you join a group. Join a group. If you are not in a study group, please join a study group. There is power in studying with others. You can test each other and you can also share resources. Okay? You can also share resources. Now, let's go to part 4 of this video where we talk about the examination day. The examination day. Now, let's talk about what happens on the actual exam day. Now, on the actual exam day, what do you need to bring? Remember, you need to carry along your index number, your NMC admission letter, a valid ID card, and your stationery. Usually, you will need a pen or a pencil, and maybe if they are still in use, that is the face masks, please take it along. What to expect? Now, make sure you arrive at your station or you arrive at the examination station at least 1 hour early. You'll be directed to your exam hall and seated according to your indexed number. The invigilators will explain the rules to you. Once the papers are handed out, make sure your index number is correct on the answer sheet. Make sure your index number is correct on the answer sheet. If you are going to be using the computer as we did, make sure that your index number is correct before you do anything. What not to do? Remember, do not bring phones, smartwatches, or even calculators unless they are allowed. Don't talk during the examination and don't rush to submit your work. Remember, the computer that you are using will automatically submit the work for you if you do not submit the work before the time runs out. So make sure that you always double check your answers. Always double check your answers. Double check your answers. And finally, I will say that stay positive. Confidence is half the battle. Confidence is half the battle. If you've prepared well, trust yourself. For that, I will say thank you so much for watching this video. If this video helped you, please like, comment, and subscribe for more nursing tips and study content. If you have any questions about the exam, please feel free to leave them in the comments. I will try my best to answer each one. And remember, you've got this.